Hi, good evening. Austin Mayor Steve Adler. Got a minute? All right, we're going to go through the COVID numbers here in what will be our last got a minute. It may be that we have to pick this back up again to talk through numbers, but generally the numbers are low enough and flat enough. There's just not a lot to report on a nightly basis. I promised Diane that when we got to this place, I would open up my evenings again for her and for the family. So we're going to move away from Got a Minute. We are going to go to a weekly podcast, and we'll talk about that in just a second. But while we're here, let's go through the numbers. Let's go through the last round of the Dr. Escott data dump, so that we can see what the numbers are. Let's begin with the key indicators for staging. These are the numbers that we always start with. You can see that the number of new admissions in the last 24 hours, 25. That is significantly above the 7-day moving average. It in part is reflective of the fact that we have a lot of new cases. The case number of cases, the 7-day moving average has been going up. Again, not the same concern that was in the past, because fewer people that get the virus end up in the hospital. Fewer of those end up in ICUs and on ventilators. But even still, the more virus we have in the community, the more it's being passed around from person to person, the better the chances that the variants will take hold. The better the chance that we could end up in a situation similar to what they're seeing, what's happening in Michigan, where the numbers are going up. In fact, the numbers of new cases have gone up in the state of Texas, I think, for the first time in 10 days. It's not a good sign. Most of that increased number of cases, I understand, are in Houston and El Paso. But it's still a concern, even though our numbers have generally stayed low. The positivity rate now is at 4.8%. You'll notice that that's gone up a little bit from where we were. That's a little bit of a concern, but we'll talk about that in more detail when we see Dr. Escott's data. But let's take a look now at the folks that we do have in our hospitals, just so that you can see those numbers. This is looking at the Travis County general dashboard numbers. You can see the total number of cases we have are 80,799. It's about 6% of our population in terms of new cases. We estimate that the total number of people that actually got the virus, probably 3 times that number. But a lot of people were asymptomatic. They didn't know they got it, and a lot of people got it and just weathered through it and didn't show up at a place or get tested in a way that we'd be able to grab that data or to be able to support it. Number of people that are in the hospital is 135. The 7-day moving average is 132. So the hospitalized number higher than the 7-day moving average. But ICUs at 36, down 2 from the 7-day moving average. Ventilators at 18, down 1 from the 7-day moving average of 19. Lest you think that we're past the virus here and it's not still deadly, 831 people have passed away. That's an increase of 2 since we were last together. Still a dangerous virus. Urge everybody still to be careful. We're so close. You don't want to be one of the last group to get the virus. We can take a look at the University of Texas dashboard. This is the model that predicts what's happening. You can see that the R factor number is up at 0.87. That the range is up to 1.63 from 0.58 to 1.63. That's higher than it's been. That means there's a greater chance that the virus is increasing. The probability of the epidemic is growing up to 35%. That's nearly double what we had seen before. The 7-day change in infection is 14%. That's up from what we saw before, too. You can see that still the projection, because R factor is less than 1 at 0.87, still has us going down, but the numbers don't go down quite as fast as they were before, and we really don't get to 10 till a much later place. You can see this is predicting May 12th, still not down to the 10 level that would get us into stage 2. Let's take a look at the data dump from Dr. Escott. We'll move through it pretty quickly. But for those of you that either live or the several thousand that take a look at this later on, let's take a look at this data from Dr. Escott and from Director Hayden, as presented to the joint meeting of the City Council and the Commissioners of Court yesterday on the 13th. First thing they talk about was the recommendation to pause the Johnson & Johnson vaccine. Just want to make sure everybody understands that 7 million of these vaccines were administered. There were 6 cases of a blood clot, pretty rare in females. They were off women aged 18 to 48. One of them passed away. One is in critical condition. Even though the chances of this happening were exceedingly rare, 6 in 7 million, the FDA recommended pausing Johnson & Johnson at this point. So 2 things. If you got the J&J and you're experiencing severe headaches, abdominal pain, shortness of breath, or leg pain within 3 weeks of getting the vaccine, you should contact your healthcare provider immediately. One of the reasons that this was paused was because it's a pretty rare blood clot, and the treatment for this blood clot different than other blood clots. And they wanted to make sure that they got this information out to physicians, so that if anybody came in, they would be armed with that information. That makes sense. Still think it's a good vaccine to get. And let me make sure that we're getting this page up where you can see it. In fact, my daughter and I both got the J&J vaccine. Let's take a look at the next page from Dr. Escott. It's an interesting one. This shows you there are conversations and discussions about whether or not we've reached herd immunity. Herd immunity requires anywhere from 70 to 85% of the people to have gotten the antibodies. The belief is if we get up to that level, then the virus will die out. We're in a much safer place. But we're not close to herd immunity yet. And let me show you the numbers. You can see from this chart that the number of people who have received both doses or final doses of the vaccine, 22% of the people. Now, another 14% have gotten 1 dose, not fully vaccinated, but even with the 1 dose, that gives you an awful lot of protection. So that means, in a liberal sense, trying to get the numbers high as it could be, 22-14, that equals 36% of the people in our community have received either the first or second dose of the virus. Add to that the number of people that might have antibodies. About 6% of the population we have seen got the virus, so they should be carrying antibodies. We know that's not everybody. As we talked about a second ago, some people asymptomatic, some people just weathered through it. And if that is that number, the total number is 3 times the number of cases we know, that'd be 18%. So the 6 plus 12 equals 18. 18 plus the 22 plus the 14 is 54%, which means that 46% of the people don't have antibodies. And we have to get up to a place somewhere between 15 and 25, 15 and 30%. So we're not anywhere near that number yet. And what we're finding is that while there were a lot of people trying to get the vaccine early and lots of lines and people trying to get it, when Austin Public Health opened up their logs for people to register and get in, about 10,000 were offered, only about 2,400 people signed up to get it. We'll continue to get all those vaccines out into people, but it just shows that we're in a little bit different place. I encourage everybody to get the vaccine. The sooner more and more people get it, the better off we are. And the right vaccine for you is the first one that you can put in your arm. You can see the number of new cases here starting to go up if you look at the right side of the graph. And that's really what we're seeing. That's the concern in the city. Number of new admissions staying flat. If you look at the right side, this has the number of hospitalizations, ICU admissions, and ventilator use all going down, but still roughly flat. This is the University of Texas modeling we looked at a second ago. Age groups, you can see that in the past, older folks were the highest percentage. That's gone down. Now there are no greater percentage than middle-aged folks that are getting it. But as the older folks go down in percentage, the younger folks come up higher, and 10 to 19 is the number we have seen go up, probably because of communal school activities, choir, band, sports, that kind of thing. Here are the absolute numbers behind the chart we just saw. You can see the overall number of people going down from 154 in the hospitalizations to 145. Older folks staying in the general area where they were, slight increase among those 70 to 79, but still lower numbers than what we had seen previously. When you look at race and ethnicity, you'll see that the number of people that have the virus, so this is the positivity issue, or hospitalization rather, by race and ethnicity. Hispanic, all races went down slightly. It's right on top of where the white non-Hispanic are at a number that's 41.3. You can see the trends. The number in the Hispanic community were higher and have now come back down, not as low as they were just 3 weeks ago. African American that had been rising now dips a little bit. These are the numbers behind it. Total numbers going down. Total numbers in Hispanic going down from 59 to 57. White non-Hispanic going from 60 to 57. Black going down. Black folks going down from 20 to 18. So even though percentages flat, going up in the African American community, absolute numbers going down. This is the positivity chart we talked about earlier. You want the community to be under 3. We had been bouncing back between 4.4 and 4.3, 4.5 over the last 4 weeks. We've now gone up to 4.8, which is where we were 6 weeks ago. That's a cautionary sign, certainly not a big jump to go from 4.5 to 4.8, but something to continue to watch. This is positivity by race and ethnicity broken out. Different chart. You can see, generally speaking, folks staying under the 5%, which is important, close to the 3%. The number in age groups, you can see that the numbers that used to be high in the older populations are in fact continuing to go down. The concern that we see here right now, 20 to 29, 10 to 19 are high. Also surprising to me, an increase in the 40 to 49 age group. This is positivity as it exists in our schools. Remember, in the community generally, it's 4.8. High school, 6.2. Middle school, 7.3. Elementary, only 2.5. Preschool, 2.3. This is the numbers, again, that show us we're doing just a really good job in long-term care and nursing homes. Numbers used to be off the charts. They're down 98% now. If you get the virus, you should ask your doctor right away if you are eligible for the regional infusion center, so you can get the same treatment that the president got. The people around the president got it. Chris Christie got it. the former cabinet member, Carson, got it. If you get the virus, I would really suggest, especially if you're in a vulnerable group, that you check and see if you're eligible for that. It's free. The state pays for it, and it might very well just keep you out of the hospital and could keep you alive. This is the chart we look at to check flu, and we can see that we've done a really good job of keeping the flu down so it doesn't compete for resources. This is our stage chart. We're between 10 to 29. We were headed down or up to stage 2, getting below 10. But it looks like we are beginning to stall on that. We're at 17 right now. I want the number of cases to go down to increase our chances. Still wear a mask, social distance, avoid gatherings, large groups. Still, we have to continue to be careful. Health authority rules have been revised and renewed through May 18th, but with some modifications. People who are exposed to individuals who are fully vaccinated don't have to quarantine now if you're not showing any symptoms. There's also a removal of masks in limited situations consistent with CDC guidelines. That includes if you're in a closed location with somebody who is also vaccinated, you don't have to wear a mask. And it's also recommended that the minimum distance between students in school could go down from 6 feet to 3 feet. Really big numbers. This is also the dashboard about vaccines from Director Hayden Howard. 285,000 vaccines given out by the safety net folks. That's the City of Austin, Travis County, Community Care. You can see this is the percentage here of people that are over 65. If you go to the website, you can see that we're achieving much higher than those numbers with respect to races and ethnicities. Still not doing the job we need to do in really getting the virus vaccine to those that find it more difficult to go online or sign up or to compete with drugstores or other places, grocery stores, people who are alone in their homes. And really need a trusted person to help them. Austin Public Health now is moving to get more vaccines in churches. There's going to be one up at Northeast High School now this weekend on Saturday. So we're targeting more in locations, walk up or sign up, but trying to get to the people that might be most difficult to be able to sign up. This tells you what the total population, it says fully vaccinated, it's not. It's people that's gotten one vaccine or another in Travis County. We've gone down now. Anybody over 18 is scheduled to sign up for first doses on Monday and Thursday. So if you haven't done it yet, tomorrow would be a great chance to go ahead and to get that done. So that's the information and the data dump. So again, it's been great doing Got a Minute. I've really enjoyed the feedback that I've gotten from people in the community, in emails, people on the street. It was just lunch today. Someone else told me they appreciated having that kind of feedback and information brought to them and insight. It's really been a pleasure to be doing it. And again, I loved all the pictures that people sent when we were just starting off. I love the demonstrations where we made masks out of t-shirts when it was starting off. And I really thank some of the folks that have come on and participated in this time with us, bringing information to the community. But it's been a year since we launched last April. But now that the vaccine supply is increasing and the mortality and hospitalization rates are decreasing, we just don't have enough new information to report to justify doing this as regularly as we have been. Thank you to everyone who has followed along and use these updates to make smart choices for you and your family and your community. We are going to move to a weekly issue-based podcast where we try to give you some behind-the-scenes information and insight and my thoughts and what I'm seeing or hearing information that's coming to me. I'll share. The purpose is to reach a greater number of Austinites and educate and have a discussion on various social issues. If you have questions that you want answered on a podcast, please email me. My email address is steve.adler@austintexas.gov. steve.adler@austintexas.gov. And with that, I'm going to sign off on Got a Minute here for the last time. I wish you and your family well. Take care, be safe, and good night.